Let's talk a little bit about sexual rehab after vaginoplasty.
Yeah,
When can folks expect to fool around gently, aggressively? That's the thing?
we're still on vaginoplasty, correct?
We're still in
Okay,
vaginoplasty, yes.
okay, great. So our general rule of thumb is as soon as it's comfortable to start exploring your new anatomy, go for it.
Yeah.
There can be a fair amount of bruising and swelling and tenderness right after surgery, but after a couple of weeks that tends to subside. And so as soon as it's comfortable to start exploring, go for it. For some people, it's useful to use a vibrator in a low setting that just to get a sense of where the sensation is, where what feels like what. Because Dr. Gupta has rearranged that tissue, then there's a good chance that you've also, some of the things in terms of sensation have shifted along with that. And that's, in fact, one of the goals. Um, as far as any type of penetrative sex, we absolutely recommend at least 8 weeks without putting anything in the vaginal canal except for your dilators. And after 8 weeks, it really just depends on the individual.
Yeah.
Are you comfortable with penetration? If you feel like you need some more time before you begin that, you will have a sense of that from your dilation experience, although obviously that's not the same thing.
Yeah. Yeah, I mean, I think it's crucial to underscore that. I mean, 8 weeks doesn't mean that you'll be ready for prime time at 8 weeks. I mean, sometimes it's 3 months, sometimes it's four, sometimes it's even later.
Yeah.
And, I always think of, any kind of sexual activity after gender affirming surgery as, learning things anew.
Mm-hmm.
And, the neo vaginas that we make, for instance, they don't lubricate on their own. They tend to stimulate. So you have to use all of the available things at your hand, light, dim lights, music, foreplay, a little bit of wine, a little bit of Marvin Gaye, or whatever it works for you. Some some people, when with their partners, make a weekend out of it. So go to a quiet cabin in the woods, kind of a thing. So yeah, kind of do all of those things, and I think that goes a long way.
And that's another place that the pelvic floor physical therapists can be helpful.
Yeah.
In terms of not only knowing your way around down there, but also what's pleasurable, what's not, and where those new kind of parameters lie. Oh, I guess also no bathing
No bathing.
until the 8 week mark.
Mm-hmm.
Can you speak a little bit? So this question comes up for some folks because we say no penetration. What about oral sex?
It really depends. Are you the provider of oral sex? Are you the receiver of oral
So
sex?
let's say this is a person who's undergone a vaginoplasty who is going to receive oral sex.
Yeah, I think it's fine at probably at the. I mean, I always feel like exploring your own body with your own set of limitations and whether it's a vibrator on yourself. I mean, that's okay because you have immediate feedback of what hurts and what doesn't.
Mhm.
If you have a very understanding partner, and
Hopefully you do.
hopefully you do, and they're very accommodating, then yeah, I mean, I wouldn't have any issues at the 6 week mark, but probably the 8 week mark is probably safer. What do you think? Because
I mean, my rule of thumb is if there are any open areas whatsoever, hold off
yeah,
because our mouths are full of bacteria. That being said, I think any type of sexual activity, whatever floats your boat,
yeah,
it's really about communication. So if you have good communication, you can negotiate that